All right. Good afternoon, everybody. Hope everyone's staying well. My name is Chuck McShane, Senior Vice President of Economic Research at the Charlotte Regional Business Alliance, and today we have some new data that's been released yesterday. It's about growth in the Charlotte region, and a lot of that has ground to a halt now with the coming pandemic. But it's important to take a look at where we've grown, how we've grown, and how this pandemic might affect the future, both of data collection and where we're going as a region. And with that, I have Rebecca Tippett Dr. Rebecca Tippett from the Carolina Population Center joining us today to dive into some of these new numbers from the census. Welcome.
Thank you for having me.
Can you tell us a little bit about the Carolina Population Center?
Yeah, so the Carolina Population Center has been around for over 50 years. It's a global population research center, and the unit that I direct, Carolina Demography, is an applied demographic unit, and we really specialize in doing research consulting to help individuals and organizations understand how and why population is changing, with a specific focus on North Carolina.
And you've had a chance to take a look at some of the new numbers that came out yesterday for 2019.
Mm-hmm.
Was there anything surprising in there for you?
So the first big surprise I would say is that this is the first estimate that I've seen this decade where Wake County is estimated to be larger than Mecklenburg County.
Really?
1,400 individuals. Again, these are estimates. The further away we get from the decennial census, the more error there is in that. So a small percentage error means that this is within that margin that we would expect. But what I'm really looking to see in 2020 is whether we return to the 1800s, right, with Wake being larger than Mecklenburg. So that was one of the more interesting things I saw. Other things were kind of either a continuation of longer term trends or a continuation of trends that we've seen the past few years.
And some of those trends have been interesting over the last few years. I was reading Jed Kolko, who's the chief economist from Indeed, mentioned that urban population growth in the nation had essentially ground to a halt. That's not entirely true in the Charlotte region. However, urban population has trended down as the suburban population has gone up. And I'll share a presentation here to give you an idea of some of our numbers here in the Charlotte region. One second here. So starting from the beginning here, we've surpassed about 3 million people as a region, as a 15-county region, with most of the growth happening in Mecklenburg and the surrounding counties over the last 9 years. If you take a look at our growth trends, and I'll move our faces out of the way here, so you can see we really peaked as a region in about 2016 in terms of growth, almost at 2%, and down to closer to 1.5% in 2019. Still growing much faster than the national average. But if you take a look at Mecklenburg County, while it was leading in growth earlier in the decade, it's kind of converged now with the Charlotte region. So a little bit less growth there. And then you take a look at the 7 bordering counties in that gray bar, and you see them now growing faster than the rest of the region. And now our 7 non-bordering counties, the ex-urban counties, have recovered from negative growth, but are now growing in positive territory, but much slower than the rest of the area. What does this say to you, Rebecca?
So this is actually, this trend that we're seeing is very similar to kind of what we saw more broadly across the state. One of the things that we saw was early in the decade, it was, we were still recovering from the Great Recession. We really had kind of limited supply of housing, as well as a lot of individuals still had limited capacity to pay for housing. They're underemployed, and the lending markets just were relatively constrained. And what we saw in the first half of this decade was that urban areas like Mecklenburg, and not just urban areas, I think the core counties of those urban areas, Wake, Durham, Mecklenburg, were really driving the state growth. And about half of counties had lost population in the first half of the decade. And what we've seen in the past few years is that kind of return to pre-recession growth patterns where we have suburban and exurban counties growing often at a faster rate or their fastest rate that they've seen this decade. This isn't to say that the core urban counties are not growing. As you just showed us, they're still growing at quite a significant pace. And North Carolina remains, it's growing faster than the nation on average. But definitely we are seeing kind of this trend towards housing prices are spiking in our urban cores, and we're seeing more home affordability, more lending, as well as enabling people to purchase homes in further flung areas. And we're seeing people make that trade-off to have a little bit more commute. They're still working in the urban cores, but they may be living in a suburb or an exurb. Or we're also seeing some older adults, so grandparents. My favorite quote that I've heard recently, I don't know if you've heard this term, baby boomers chasing babies. So older adults who move to be near their children and either their current or hopeful or anticipated grandchildren, as well as the fact that these urban cores often have high quality medical amenities, right, which we know is a big attraction to Charlotte, both as an employer, but also if we think about that as a lifestyle or amenity that is going to be attractive to people in retirement age.
Right. And how do you think the COVID-19 pandemic will affect these trends? I mean, obviously people can't move now.
Yeah.
What will we see next year when it comes to this, both from the urban and suburban perspective?
So, well, the upside is that we probably won't see much impact next year because we are already well into 2020, and the estimates are going to be centered that we're taking the 2020 census right now. So that's in field, and the estimates are centered around July 1, 2020. So where I think that impact is really going to be seen is much like when you see poverty rates or unemployment rates spike, not during the worst, they often spike after the recession is over. We're going to see, I think, some of these things will have a lingering impact. And honestly, what that impact is, I have no idea, right? If you don't mind, I would share my screen and we can talk through a bit of where I think we could see these things intersect.
Sure.
So I'm going to pull up, we're publishing an interactive later today of just kind of similar things that, can you see this now?
Yes, I see it.
Okay. So publishing an interactive. So this is similar to your presentation, looking at change from 2010 through 2019. And of course, it chose right now to reload. But what we see is kind of the counties in green, those are counties that have lost population. The counties in blue have grown. Wake and Mecklenburg clearly dominating here. The state as a whole gained just under 1 million new residents over this time period. 210,000 went to Wake, 190,000 estimated to go to Mecklenburg. That's about 40% of the state's change in just those two counties. Keeping in mind that they have about 20% of the state's population right now, but picking up about 40% of the state's growth. We're seeing the Sandhills and the Northeast are really experiencing kind of steady, consistent population losses, as well as some of these counties on the border. But where I think when we're talking about coronavirus or COVID, there are two potential ways in which it's going to intersect with some of these trends. And the first is that with an aging population, we're already seeing many North Carolina counties where they have net negative natural increase, meaning that they have more deaths than births. Some of these communities, like those out west and Brunswick County, are faster growing communities, and they're growing because of in-migration. So this is the natural increase map. This is the net migration map. And you can see that there's the potential that in counties where they're really driving from net migration, particularly because it's domestic migration, that could be halted significantly. And we do see net migration drop significantly after recessions. So it may be that we're going to see that really grind to a halt. And the challenge is that when we know, because of an aging population, net migration is really, for many communities, the only source of population growth. You have net migration slowing down, and then you have possibly aging populations where if they're impacted by the coronavirus, this could push them to have even more deaths than births. So you have kind of potentially two compounding factors. Of course, we also know many of those communities are rural, and rural communities have been relatively buffered from some of the impacts of coronavirus so far because they have a natural social distance. So it's a really nuanced interplay of factors. And I think it's going to take us months to even begin to understand what the impact could be and years to truly understand it.
Right, right. And even in the Charlotte region, I was looking at some of the numbers. Natural increase is only 26 to 27% of the growth in the region. So we're also reliant on that
Yeah.
to continue growing.
Yeah, and like that's where Charlotte and Wake really differ, is that the Charlotte area has a little bit more natural increase going on as a component of growth. The Triangle is particularly reliant on net in migration for its growth relative to Charlotte. So we also see, for example, our military communities, natural increase is a big factor in population growth there. But I mean, this is going to be widespread impacts nationwide. And so in many ways, what happens in North Carolina. The other thing we need to think about is how these intersect with pre-existing comorbidities or risk factors for COVID. So we do know that in kind of the Sand Hills, Northeastern region, there's high prevalence of things like hypertension and diabetes that may be complicating factors. And then these are compounded by what we've seen with rural hospital closures and potentially lack of medical facilities. And I know some epidemiologists at UNC right now are working to map some of that interplay and intersection to understand the potential implications in North Carolina.
Yeah, a lot of issues to think about there. And just to point out too, I know your organization's focus is on North Carolina. We have 4 South Carolina counties in our area, and 2 of those are the fastest growing in our region. Both York and Lancaster County are growing rapidly. Shifting gears a little bit, you mentioned earlier that we are now in the run up to the 10-year census, the decennial census, which is the constitutionally mandated count of everybody in the U.S. And obviously the pandemic is complicating this quite a bit. How is that going? I know your organization is tracking response rates. Where do we stand on that, and what can we do to improve response rates there?
Yeah, so right now we're updating weekly on response rates, and actually I'll, again, take advantage of the benefits. Oops, sorry. I'll try to go ahead and pull that up as well. But one of the things that we're doing, we're updating weekly. The Census Bureau is releasing this daily, but weekly updates to kind of give the key takeaways. And what we're finding is that North Carolina really has been lagging the nation. We're about 3 percentage points behind the national self-response rate, largely because we're tracking at ncdemography.org, and that's 2020 census tracker. And that's really driven by a lagging response rate online. So this is the first decennial census when all households have the option to respond online or by mail or phone. Now, I do want to point out that we were kind of 41st in the nation in self-response as of Monday morning. However, it's important to know this is early, right? Census Day is April 1st. Most households had only gotten 1, maybe 2 notifications to complete the census by the time we did this. And in particular, we saw that some of the lowest responding counties were in Western North Carolina. And that could reflect a few factors. Mail times may be a little bit delayed in more rural areas, or we may have lower broadband penetration. So individuals may be more likely to respond by mail, which means that their self-response kind of turnaround is going to take a little bit longer than somebody responding online. The other thing that we might see is that in some of these communities, we have a high proportion of vacation homes or secondary homes. And when that happens, all housing units are sent a mail response, an invitation to complete the census. But if they are not currently occupied because the person who owns that home their primary residence is elsewhere, we may see low self-response rates in vacation destinations or kind of second home communities that do not necessarily reflect a low individual response. Those are just kind of vacant housing units that are not going to readily respond right now.
And what? Go ahead.
Go on. Yeah.
So in your expertise, why is it important, particularly now in this time, that we get that response rate up for the census?
So there's a couple reasons why we really want to get the response rate up. First and foremost is that self-response, which means that you fill out the census form for your household without a Census Bureau person coming to your door is first and foremost is the most accurate data that we can collect, and second, it's the most cost-effective data that we can collect. So from a demographer perspective, I'm really concerned about accuracy. From a citizen perspective, I'm really concerned about cost. Right? I would like for this to be a cost-effective census. The other reason that we really care about it is because the census is fundamental to kind of a few things. First, it's tied very strongly to power and money. So when we think about power, that's political representation in the U.S. House of Representatives, that's drawing of those district lines to be equally kind of fair. And that is at both the House level for the U.S. House, but also for the state legislative districts. Other thing is money. It's used to distribute billions, if not trillions, of federal dollars over the decades. So North Carolina gets about $24 billion annually in federal funding that's directly or indirectly tied to census counts. So we think about it as being vital for both our fair share of federal funding as well as equitable allocation of those funds to communities across the state. Third, from your perspective and maybe the chamber's perspective, is census data is fundamental in virtually every data product that comes out of the federal government. So when you're talking about economic development, business location decisions, all of those are incredibly reliant on an accurate census count. And related, fourth, census data is the backbone of virtually every statistical or research product. So if we get this count wrong, it means we don't know how many people, what mortality rates are from disease. We don't have good estimates of fertility rates. There's all these fundamental things that we take for granted about being able to understand in our community that are really at heart reliant on a good, complete, and accurate count in the census.
Yeah, the Charlotte Regional Business Alliance uses census data every day and everything that we do in terms of research. And obviously it's crucial now to get the proper amounts of federal funding and federal representation, particularly.
And I'll pull up, we're doing county level things, so we can actually look at Mecklenburg specifically. So.
And we cover Mecklenburg and 14
all 100 counties. We don't have South Carolina in here. So, apologies. I think it's right here. So we'll see where Mecklenburg stands. So Mecklenburg is actually, looks like a little bit because of rounding, right? The challenges of automating things, but it's about average with the state. And what we're seeing is that slightly more likely to be responding online and slightly less likely to be responding by mail or phone compared to the state average. And you guys have some really high responding tracts. You have one tract where about 1 in 3 households have already completed the census form. But then at the other extreme, you have the bottom 5 tracts, only about 1 in 20 housing units has completed. So part of this is we're publishing this weekly, and we're also publishing a data file that allows people to look by census tract, because there's been a lot of organizations that are doing it was boots on the ground, right? Now it's probably virtual boots on the ground outreach and engagement to really get out the count. So similar to get out the vote efforts, but get out the count efforts to make sure that all communities are well counted and completely and accurately counted in the census.
It's vital. It's vital for our future as a region and as an economy. Rebecca Tippett, thank you for joining us today. And
thank you for having me.
Stay well.
You too.